So, hello everybody. My name is Soraya Carrim-White. I am a trained counselor psychotherapist here in St. John's, Newfoundland. I've been in private practice with Compass Health Center for about 10 years now. And I do a lot of work with, obviously mental health, but stress management, depression, anxiety, and I do a lot of work with chronic pain. So yes, born and raised Newfoundland, and I have two kids. I have a 5-year-old girl and a 3-year-old boy. And my daughter actually was born with profound hearing loss, and she has cochlear implants and is doing quite well with the help of so much support around her in our community. So I really thank Canadian Hard of Hearing Association for asking me to do this, and hopefully I can give a lot of information or new information on mental health and how it can be affecting your chronic pain and different skills and coping techniques to help along the way. So our topics today is mainly on mental health and coping with Meniere's and Tinnitus. And we're going to start a little bit with just talking about, and let me learn how to move forward here, just mental health in general. We're going to talk a little bit about stress management, and then go into some techniques such as cognitive behavioral therapy and mindfulness. And both of these techniques have been shown to be quite helpful in helping reduce some of the symptoms you may feel with the disorder, with the diagnosis. A lot of this you may know or you may not know. I'm going to keep it very general for now, but basically a mental health overview. What is mental health? What is mental health care? Mental health is defined as a state of your psychological and your emotional well-being. We know a lot about physical well-being and how to keep our physical bodies healthy. And that's paying attention to the body itself. Exercise, water, fresh air, a lot of things that we can do to keep our physical body, sleep, a lot of things we can do to keep our physical body healthy. Mental health similarly has those important factors and needs that we need to be aware of and take care of. And those refer more to our thoughts and our feelings, and then the behaviors related to those mentioned. Excuse me. And a part of it is being able to recognize, understanding the importance of self-care and looking after ourselves, whether we are struggling with chronic illness, whether we are struggling with financial concerns, whether we are struggling with grief or life in general, stress, is being able to know what works as positive self-care for us, and then what other things we can do to help overcome stress. So there is a mental health spectrum, and it's not just you're either unwell or you're well. There's so much gray in between. I think the latest statistics have shown that 1 in 4 Canadians at some point of time will struggle with a mental illness of some sort, whether it's depression, anxiety, postpartum, chronic pain, grief. Any of these stressors can be seen, or people can be diagnosed with a mental disorder. It's 1 in 4 in Canada. In Newfoundland, it's actually 1 in 3. The research has shown in the last 5 years, the research, and it's 1 in 3 in Newfoundland for numerous reasons. But in general, mental health is not just the mental disorder diagnosis. Mental health is overall everything we do to keep ourselves emotionally healthy, emotionally able to keep going. And when chronic pain plays a role in there, we can struggle. We can have that added extra external impact on us that makes it difficult for us to keep up that self-awareness of self-care. So in reality, we can struggle off and on with our mental health by being from healthy to unwell, to coping, to even struggling. And all of these are up and down and fluctuate depending on what's going on in our lives in general. My own picture is blocking my slide. So, when we're feeling more healthy mentally, that's when we have that idea of more self-care in place, more social supports around us. And then as we start to struggle is when it's time to really evaluate to say, should I involve more community supports? Should I look at more professional health? And then with crisis is when we go to emergency services, which are in Newfoundland, the mental health crisis line. CHHA-NL has a warm line, your family doctors and counselors such as myself. And we come in at any point of time just to help keep everything balanced at an earlier level if the awareness is there. By talking about that, when it comes to chronic illness or even stress management in general, or even looking at the pandemic right now that we're going through, we know, as an example, with physical health, we know when we have a headache that there are certain things that we will take more seriously than others. So for example, we have an understanding of our physical body to say, okay, well, I have a headache, so I'm going to either take some medications, lie down, go get some fresh air, that we do things to take care of ourselves, that self-care for the physical ailment of the headache. When it comes to emotional, it's the same thing. Having that awareness of saying, okay, what are some things we can do to take care of ourselves, to be able to take that step back and help relax some of that stress, or when we have to go that one step further. So when the headache becomes a migraine for a few days, we're going to seek professional help. When we're struggling overall with the stressors of chronic pain or life or anything, that we are able to take advantage of the supports that are around us. So when am I mentally healthy? So mentally healthy refers to having the ability to cope with daily stressors in life in a positive and healthy manner, that you're able to cope with stress, you're able to focus and concentrate on the different tasks you're doing, you're able to get sleep, you feel balanced overall, and that's mentally healthy. That's when you feel good and you're able to regulate these emotions that you have. So if you are tired, you recognize that the tiredness might be impacting your frustration or your irritation levels, but you know why, so you're able to keep going and keep moving forward. All my notes here in front of me. So when am I mentally unwell? Well, when we're unwell is when we recognize that it's harder to keep those emotions regulated. When we find that it's harder to stay in the grind and able to do those day-to-day activities without feeling that increased pressures or those increased emotions of sadness or overwhelmed or even frustrated. When we notice that the sleep is impacting us even more because we're unable to turn off those thoughts, or we're unable to turn off those feelings associated with pain and chronic illness. We're more frustrated, and then it can be that symptoms of depression and anxiety start to spill over into our everyday lives, and that coping does go down. So when is this distress too much? Because we do all have moments when we're mentally not feeling very well and we're in that coping, struggling phase. So when is it too much? So some of the definitions in the psychology world is measuring the intensity of it, how long it's lasting, and how much it's impacting your everyday functioning, your everyday day-to-day routine. So the questions you ask for intensity, is this intense? If they're not mild and it's not an everyday up and down fluctuation, but tends to last for a very long time. And what I mean intense is the emotions, the feelings of anger or irritation or sadness. Are they long lasting? Is this a day on and then you feel good for a couple of days, then you feel bad again, and then depending on what's going on. In general, for depression and anxiety, we look at the definition of 2 weeks or longer with a significant decrease in ability to function and increase in the symptoms associated with depression and anxiety. If you've had that for 2 weeks, that's when we would look at a diagnosis and for further interventions, because we know it's really difficult to function for a long period of time with this overwhelmed, mentally unwell feeling. And then the impact is the negative consequences that also play a role. So it's impacting yourself in how you feel, but now it's also impacting your ability to work, your ability to enjoy time with loved ones, your ability to complete your regular goals. That's how your mental health can also show as impacting your life. With chronic pain, that's another factor, because as the pain increases, the emotional awareness of that can also increase and can affect how you feel. We know that if we have a headache and it goes away with an Advil, we feel better pretty fast. But we also know that if there is intense ringing and it's not going away within 20, 30 minutes, or you're on day, you wake up the next morning and you haven't slept well because it just will not even decrease in intensity, we know that that's going to impact how you feel overall. There are different things that we can do for that, but on the mental health side, we'll come back to a little bit later. So how to improve your mental health? Now, these are very general. I'm talking top level right now, and we can go deeper into any of them if you'd wish, with either during this workshop or even later. So in general, improving mental health. So there are things you can do, even though they can feel difficult at the time. And this is the self-care, but in addition, it's spending time with your friends or your family, or just people that support you, that you feel supported. And asking for help when you need it, which we talked about a little bit earlier. Then including those physical self-care parts, which is the exercise and the healthy eating and getting outside and drinking enough water. All of those things can help improve the overall mental health. Self-care is a big one. So what comes with self-care is really the taking care of yourself. How do we take care of ourselves? Well, it's showing care and concern for our mental well-being and acknowledging it and being able to say, okay, what are some things that I can do to help myself feel better, or at least feel one step better than I do right now? Part of that is learning how to decrease some of the stress. And we all have stressors. And with the pandemic, we probably have even more stressors than we thought we'd ever have to face right now. And it's part of prioritizing and recognizing what are some things that we have in our control to change. And then start slowly by changing those things. Again, with help. It's very difficult at times to do that on our own. Increasing happiness, which is finding some achievements and some pleasures that you enjoy. And that can help you feel that sense of accomplishment, which also increases our confidence and then our self-esteem, which also can help us feel a little bit better. So achievement, self-care, is basically doing something that makes you feel like you've accomplished something, and that satisfaction comes in. So the achievement could be any sort of goal that you wanted to complete, whether it's knitting a blanket or wanting to eat something new, or which would also fall under pleasure. Myself, I struggle with chronic pain, and one of my achievements has been to complete the Tele 10, not run it, not time it, just complete it. And it was achievement that I had put in place in my head about 15 years ago. So I was taking my time achieving that. But so I was able to take some time, carve out some time, especially with a 5-year-old and a 3-year-old, to go and try to walk this. And I'm very happy to say that I was able to do it a few weeks ago, and it still hurts. but it's a sense of achievement. I feel like that I've accomplished something. And so any examples you can think of on your side. The pleasure side is doing things that you find enjoyable, things that help you feel relaxed, things that can get you out of your head a bit and concentrating a little bit more on things that make you feel happier. So the knitting, the running for some people, cooking, movies, any of the things that you hear from all over the place in the mental health world that actually can help you. And when we struggle internally with chronic pain or depression or anxiety or stress, these are things that we can help just to ameliorate it just a little bit, make things better, finding some sense of joy when it's so easy to concentrate on what makes us feel unhappy. So here are just some more examples of achievement type things. Even showering is a big one. And I've noticed during the pandemic itself, just right now, a lot of people are working from home. A lot of people are not working. Just the change in general of increased isolation. And I've noticed that clients in general and even friends, the need to shower isn't there. And therefore mood does deteriorate a little bit because we're not taking care of ourselves the same way as we normally do. And so even taking that time to say, no, every morning, whether I'm home or not home, I'm going to take that shower. It's that sense of accomplishment, that sense of achievement that I've done something for me to start the day. Again, seems so small, yet does make a significant difference to our mental health. And then here are some examples of the pleasure self-care. And those are a lot of the same examples that I said earlier. So what is stress? Stress, as defined here, is the emotional and physical response to demanding situations. And stress can be there for numerous reasons. In this specific scenario, it's for the chronic illness and the pain and management. And as we find that symptoms increase even with the Meniere's or the tinnitus, that we're able to recognize that as the symptoms of those increase, sometimes our stress will increase because it's harder to manage overall in a lot of different areas of our lives. So some of the symptoms, that you may be experiencing, such as the imbalance, the dizziness, the hearing loss, the ringing and buzzing, those are some of the stressors that may come to mind for you. And if there's anything else that I haven't mentioned, please feel free to type it in. The other stressors besides the symptoms themselves are the fears associated with these symptoms, such as worrying about, how this is affecting you now, worrying about, okay, I'm feeling these symptoms now. Am I going to feel them 2 hours from now when I have to go out? Am I going to be able to go out? All of these different worries of what am I going to be like 10 years from now? These are stressors. These are the internal stressors that come with that worry. The diagnosis itself can make us feel anxious and increase our stress levels. And so this anxiety can be seen as feeling overwhelmed. You notice that your breathing is changing. You're either taking more shallow breaths or you're holding your breath more as your stress increases. Even your shoulders, you're tighter everywhere. Heart rate increases, get more headaches, more sleep difficulties, and more procrastination, just because you don't have that emotional or even physical energy to complete those tasks that you normally or regularly would do. But in addition to that is that worry that I just brought up. And so, if we want to go deeper, and you please tell me if I'm off base, but if you want to go deeper of that fear of balance, that fear of getting injured or being embarrassed, the fear that comes with hearing loss and increased hearing loss, fear of pain, the more uneasy when it's dark or in new environments. We start overthinking and analyzing everything because of what you've already experienced or are fearful that you may experience. And this affects our confidence, this affects our self-esteem overall. It plays a big role in how we feel mentally. So we know there's the physical components, and now we have all this mental component on top of it that's not always talked about or not always recognized. Not all stress is bad. We need stress to survive. We need stress to make sure we look both ways before we cross the street. We need that sense of anxiety to keep us motivated to keep going, up until it becomes a problem, which is when it's too intense, it lasts for too long, and it impacts other areas of our lives. But it's a tool that we can use for us. And when we recognize the symptoms of when your own levels of stress are more than what they normally are, what they usually are, that's when you can learn some new interventions to help bring that down. Then if you bring the stress down and the anxiety down and the worry down, then hopefully the pain will also decrease, not go, but decrease, because you don't have that added impact on top of you. And some of the options and recommendations that come in with this is the things you would probably hear before. So prioritizing your things that you need to do, organizing yourself, staying healthy. So organizing yourself, the prioritizing, staying healthy, doing all the things we mentioned before. But another one is managing negative thoughts. So negative thoughts are, and I can read this right here, if things feel out of control or any of the above recommendations are becoming difficult, then take active steps to intervene now rather than later. So negative thoughts, which is another handout I included, are just that. They're thoughts. They're not factual. They're not always rational, and they're not always right. Just because we think something doesn't mean it's true. So what are types of negative thoughts? Such as, I'm always going to feel this way. I'll never feel better. Things are always going to be like this. Things are going to get worse. These are negative thoughts, you know. The what if statements. What if something bad happens? What if I fall? What if I can't hear what's going on around me? What if I'm embarrassed? All of these what if statements, which are called catastrophizing statements, are just that. They're negative thoughts. We do not have a crystal ball. We're not able to tell the future, but yet our minds can take us to places very dark and very deep very quickly. And it doesn't have to be that way, because we know, if we know that we have a thought, we know that it's not always factual. Thoughts make us how we feel. So what we think affects how we feel, and then how we feel affects how we're going to behave. So we sometimes recognize how we feel fairly quickly. What we don't always know is that there's a thought that precedes that feeling. If I feel sad, I don't just feel sad. I'm thinking something, whether it's quick or fleeting, I'm thinking something that's making me feel sad. And therefore my behaviors afterwards are going to be in response to my sad feeling, whether it's crying, whether it's isolating, whether it's feeling tired or wanting to sleep. All of those behaviors are because I'm feeling sad. But why I'm feeling sad might not always be rational. This is very pertinent when it comes to pain management, because we know that with pain, we can get very dark. And it's very easy to allow ourselves, and make it sound like it's an easy process, but to allow ourselves to think those really heavy thoughts, because we're in so much pain. It's harder to argue with them. It's harder to argue with ourselves. And so, it's easy to go to the negative than it is to work on the positive. And that's where that handout comes in, of helping recognize that if we understand where our thoughts are coming from, then we can change them. And this is the underlying theory or the underlying research behind cognitive behavioral therapy, which is a type of therapy used for pain management, and it's like the gold standard for anxiety care. And so it's understanding our thoughts can be negative and irrational, and then help us learn new ways of framing those symptoms that we have, and therefore we cope better. And that's the underlying of cognitive behavioral therapy. So recognizing our negative thoughts is one part, and that's one piece of cognitive behavioral therapy. But another piece of it, and also introducing another type of therapy, is the mindfulness. When it comes to Meniere's and tinnitus, that a lot of the research has shown lately, especially, that mindfulness is becoming more and more useful in helping coping with the symptoms involved with both. The cognitive behavioral side of it is recognizing the emotional thoughts that we have and how to reframe those to make us feel or recognize that things can be a little bit lighter than what we're making them. Maybe not lighter, factual, than what we're making them to be. But then the mindfulness side of it as well, of recognizing that if we pay attention to how we're feeling versus distracting ourselves all the time, we may be able to cope with those symptoms better. In what way? Okay. So mindfulness is the practice of paying attention to what is happening to you from moment to moment. Easy? It's not. It's not hard, but it takes practice. It takes effort. We are really good at going through the motions. Very rarely do we take the time, in general, very rarely do we take the time to pay attention to how we feel at any given moment. Our minds are usually racing ahead to what we have to do next, or reliving the past and what we've usually done wrong or what's happening back then. So very rarely right now do we pay attention to in the moment. Some very real examples. For anyone that drives out there, that driving from one place to another, we're pretty much on autopilot. Very rarely do we pay attention to the surroundings and being in the moment. I mean, I know we're paying attention to cars and changing lanes and red lights, but we're a little bit on autopilot. Sometimes we get home and we're like, gosh, how did I get here? Same thing with eating. Sometimes we eat, especially if we're distracted by social media or television or anything like that. Sometimes we eat and we don't even recognize that we're done. We haven't tasted it all. We're not mindful and in the moment. We're always kind of going that next step ahead. When it comes to chronic pain, we tend to do this as well as a distraction technique. Sometimes we feel that if we stay in the moment, then we will feel too much, and that's too painful. And so distraction, it might be helpful. But it's been shown lately that this is actually making it worse because it increases the other symptoms of depression and anxiety and stress overall. And so in fact, sometimes the actual physical pain appears to increase because we're working so hard to push it away. And I think all of you might even have examples in your own life of times when you've done that and then realized this isn't working. So to be mindful, I mean, it says here you have to slow down and do one activity at a time and bring your full awareness to both the activity you're doing and your inner experience. But that's later. It's a bit of a process in the beginning to get comfortable with just even being self-aware of your physical body and your emotional well-being and state of mind. This is hard to do in the beginning, mainly because we're not even aware of how often our mind wanders. The goal is to concentrate on one thing, like your breathing or a focal point in your body, or even a symptom that you're having, like a buzzing or ringing. But recognizing that your mind is going to get wandered, and your mind is going to wander, and you will get distracted. And that's okay. That's part of being mindful, because we're not geared to be in the present all the time. We're not used to it. So recognizing that your mind is going to wander, as soon as you realize it's wandered, you just slowly bring it back. That's part of being mindful, that awareness. And so the point is not to keep a perfectly clear, focused mind. Even the most experienced yogis or people that have spent their whole lives meditating are unable to stay focused 100% of the time. So that's not the goal. The goal is to be able to just catch yourself when your mind wanders and bring it back. So when I say mindful, I think basically it's, I'm trying to find a very easy way of saying it. Being aware of how you feel, but not paying too much attention to it. So having that awareness, but almost allowing it to pass by, recognizing it's there, but not focusing inward too much. That's for the general definition of being mindful. So you're being aware, you're observing your thoughts, you're tuning into what your body is feeling, you're noticing what you're sensing, and you recognize that it's there, but you allow it to float by. Because it goes back to the cognitive behavioral that your thoughts do not define you. So we don't have to focus in on them. We can take that step back. That's the beginning of it. But when it comes to chronic pain management, it goes a little bit paradoxical because in a way, it's wanting you to hone in a little bit on the pain that you're feeling so that you can help make it feel less in the long run. And I'm going to come back to that because I know that was not clear at all. So some myths about mindfulness, because a lot of people might feel that this is a little bit too spiritual or religious, or it's something that requires you to sit on the floor or lie down, eyes closed. It's not like that at all. We can meditate and be mindful while carrying on through our regular daily activities. We just need to practice and know how first. Some things like I can't do mindfulness because I can't focus. Of course you can't focus. We don't expect you to focus. We expect you to try. Try to change that level of focus, and as it goes, you bring it back. As it goes, you bring it back. And the I don't have enough time, yeah, that's part of the myth of that you have to sit for an hour and meditate, and we don't have to do that. You can if you want, but in the beginning, I know when I first started learning this, I started at a minute. And even that, my mind wandered at least 3 times and bringing it back. The benefits is that it helps you understand and become more aware of your body and cope with stress. So in short term, it's been shown to help just experience a feeling of calm and relaxation. And it gives you that moment to take away the current worries and thoughts and experiences and just be there and relax. Long term, it's been shown to have stress levels decrease immensely. Your focus and your concentration improves. It's shown to have benefits in sleep, both short-term and long-term. And you find it pleasurable because you're able to slow down and take that moment away. There's a few different mindfulness therapies that have been out lately. My training that I did was in general for mindfulness-based stress reduction. And this is a clinical studies that were done out of Harvard. And one of his proteges out of the University of Ottawa came to St. John's, and we did, I think it was like a 9-day training on mindfulness-based stress reduction from the very beginning, which is where we started at 1 minute of closing our eyes and breathing and just trying to stay on ourselves. And by day 9, I think we were at about an hour, though most people did fall asleep or no, they fell asleep. And I was trying to be nice. They fell asleep. And me too, because it's a practice thing. Now, I practice this fairly regularly for my chronic pain. I don't do an hour. I don't think an hour is necessary for me, but I do take 3 or 4 times out in a day to bring myself back to being aware of how I feel and not ignoring it. And that helps my pain management throughout the day. So benefits for us in general here. So as I said before, it's a little bit different when we focus in on chronic pain. So although mindfulness and meditation is said to focus on your breath and focus on your focal points, some research has shown that when you focus in on using tinnitus, the ringing and the buzzing, it can be helpful to actually having it dissipate in the long run. This is hard. It's hard because we spend so much time trying to push away that ringing and that buzzing and trying to ignore it and distract ourselves with other sounds. And it's really hard to do. And not only that, it's painful. It's something that is sometimes painful. So focusing in on something like this is difficult. But if you focus more on this and then you realize as your mind wanders away, you're wandering away from those sounds. So if we're focusing in on being aware of the ringing, and again, we're not going to start here, this is just my explaining it, of focusing in on the ringing and the buzzing, then as your mind wanders, which it will, it wanders away from those sounds. And as it wanders away from those sounds, you get a sense of relief. Is the sound gone? No, but your brain's mechanism to try to ignore it does go back. And so that's what the latest research has shown. There is actually a mindfulness-based tinnitus stress reduction that's done out of California, actually. And so it follows these same guidelines. And I think that's fairly new, 2018, I think. And so it's following these same mindfulness tools and techniques specifically for tinnitus, and it's shown to be beneficial. So another way of what I'm saying is being able to recognize that if you're focusing in on something and then the distraction of your mind wandering is what makes it less, another way of looking at that is it's called habituation. And it's looking at, right now, I'm assuming you're all fully clothed, but you're not aware of the feeling of the clothing against your skin until I brought it up. And now you're aware of the clothing against your skin. You can feel your shirt against your arm. You can feel your socks against your feet. But until then, you don't feel it because our body has habituated to it. Same thing as if you go into a room and it's a distinct smell. In the beginning, your brain recognizes it and you smell it, but after a while, it dissipates. We've become habituated to it. That's the line of thinking behind using this mindfulness, that you become habituated to being aware of the sound, focusing in on the sound, mind wanders away, and then you become habituated. It's almost like it goes a little bit less.
And it's really interesting what you talked about with that research in California about they made something specific for tinnitus. That's not something I've heard of before, so I might research that myself actually and share that.
Yeah, I think it's 2018, and it is so like, for example, this group that I did, the mindfulness-based stress reduction, and this is Dr. John Kabat-Zinn, who is out of Harvard, and he's done all the clinical research. I mean, mindfulness is not new. Mindfulness is, we're going back Sanskrit, hundreds and hundreds and hundreds of years of meditating and being aware of where our body is and now understanding how we're being in tune with how we feel. None of this is new to us ish in the Western world, but it's not new. But then relating it to the chronic pain management, that's what this doctor at Harvard started or was able to do research on and shown a lot of benefits on how mindfulness in collaboration with the cognitive behavioral therapy, recognizing the thoughts, can improve how we manage our chronic pain.
Great.
So I'm gonna break down the mindfulness just a little bit more, and how I break it. What I'm breaking down is just, if you were in a session with me in my office or group therapy, and we were working on mindfulness for chronic pain management. And I'm breaking it down so you recognize what you would do at home on your own. So if you're ever looking this up on your own and you want to be able to start, but you don't want to you want to do it by yourself, I would recommend this route as well, just to break it down and make it slower, step by step. So the first thing that we do is, this is the meditation part of it, but first thing we do is the breathing techniques. So I would ask in general that we first learn how to be aware of our breathing. So breathing helps slow down that physiological response of anxiety or of pain, that increased heart rate, the blood flow, the dilated pupils, the tenseness in our physical body. That breathing is the first step to help relax your physical body, so then you can pay more attention to what's going on emotionally. Because remember, everything is so connected. So first thing we do is practice breathing. Then the next step after that is we would do muscle relaxation, progressive muscle relaxation, whereas you use that breathing and you start on one end of your body or the other, starting at your toes, working your way up through each area of your body, learning to relax that specific area. And that's the part where you would say, close your eyes, take a deep breath, relax your jaw, relax your forehead, relax your shoulders and your neck, moving side to side, feeling that relaxation, moving all the way down so that the muscles that are tight will start to relax. So that's the next step I would do. After that, then we would focus on the symptom itself. So we'll use the tinnitus, the ringing or the buzzing or the loud, sharp itself. And when we focus in on it, it's not a harsh focus. It would be very lightly, almost like it's not happening internally and you're questioning, what is that? So going into it very lightly, what is that? What is it coming from? Aware of the sound, not in a panicked way because your body's relaxed and you're breathing well. And what is the sound? And as you do that and your mind wanders away and then wander back again, wander away again, then you slowly use your breath, bring it back to the sound until you notice that sound goes down. Is it actually decreasing? No, but your focus in your mind has. So therefore, it's all internal anyway. So it will decrease because your attention has decreased. That sense of relaxation in the beginning, according to the research I've done, some people get, 10 minutes in the beginning. Some people get a couple of hours, but then as they continue to use this, they go for a long period of time and they're able to feel a sense of relief. When you start really short. So like I said before, we started at a minute. Some people say do 5-10 minutes of sitting. I personally think that's too long in the beginning. You'll get frustrated because your mind will wander so much, you'll get frustrated. I believe a minute, but a minute twice a day, 3 times a day. And a minute is something you can manage in between your regular routine because it's easy to close the door for a minute and take a couple of deep breaths. You can even go hide in the bathroom or hide in a workspace or anywhere in public, it doesn't matter. And while you're walking down the street, do your breathing. It's something that's more manageable in the beginning. And then that gives you that sense of accomplishment and that sense of that you've done something, that you've achieved your goal, which goes back to that self-care. So all of it then increases your self-confidence overall. And if you find it hard, be nice to yourself because this is not an easy task. It really isn't. I did training for 9 days and it's still at an hour at the end and it was not easy. It is not, it's something where sometimes the pain does get to be much, but we work through it one day at a time and you keep using your exercises, you keep using those techniques because even though your mood fluctuates, the exercises work. The training helps, but you've got to be nice to yourself and really be patient. There is a mindfulness exercise. These are my final thoughts. So this presentation is just a general overview, and we can go a lot deeper and into many different areas, into the level of depression and anxiety that comes with pain. It just occurs with coping with chronic illness in general. I don't go too deep here because everybody has different levels of pain, different levels of understanding their pain, and different stressors in general that affects everything. Chronic pain is not easy, but there is support out there. And in Newfoundland as well, as in Newfoundland itself, there is a lot of support out there that we just need to tap into. And I can help you find any help you may need if you're unaware of what's out there, and support in whatever way possible. But and answer any questions, even if you're uncomfortable asking them here, we can do that. If the ability to manage, though, right now is decreasing, not solely just because of the chronic pain, but because of life in general, because of our outside environment, finances, anything like that, if you find that things are overwhelming, I think it's important to recognize that there is more help out there. If there's any suicidal thoughts, if there's any thoughts of running away, even thoughts of just so down that you're unable to cope, it's important you know that there is help. There's myself and Compass Health Center where I work and the counselors there. There's the mental health crisis line, which is it's 737-4668. 737-4668. There's a toll-free number, and I don't know if it's 1-866 or 1-877. I'll look that up. So that's the mental health crisis line. But there's also the CHHA-NL warm line. And that's a line out there just if you want to talk, but it's not urgent. But you're not coping very well. That's out there as well. And Brittany and I can get that number for you as well, because I did not write that down in front of me. It's a great tool to have in our province. And then there's your family doctor, there's emergency, and of course there's Doorways, which is a walk-in clinic as well for mental health services. So I really wanted to mention all of those just in case we're not aware of what's out there.
Perfect.
Wonderful. Well, thank you so much for listening to me speak. And I really appreciate you having me on to talk about mental health awareness, especially when it comes to chronic illness in general, but especially with Meniere's and tinnitus. It's, I think, important to recognize all of those external factors that play a big role, let alone the pain that you feel with the symptoms.